Hi, my name's Donna, and in 2007, at the age of 46, I started noticing some unusual things that were going on with my body. Because I had received a prior diagnosis of ulcerative colitis many years earlier, probably 15 years earlier, and dealt with flare-ups several times since then, I really brushed off the notion that it could be anything other than another flare-up. Also, I was just really busy with work and was doing all the things you need to do when you need to get girls back to school. My daughters were 15 and 11 at the time. I really didn't feel like my symptoms were enough to stop my busy life. And on top of that, I was kind of chalking it up to my age, the lack of physical activity, and had also convinced myself that, menopause was right around the corner. So once my girls started back to school, I really started to pay attention and think about the symptoms that I'd been experiencing. For several months, I'd been having shoulder and middle back pain when I slept. So, my husband and I rushed out and purchased a new bed because we thought it was because of sleeping on an old mattress. But after we purchased it, the pain didn't change. It did not go away. So I started thinking back further, and really things started in June, probably June of 2007. Back then, my stomach felt a little bit bigger than usual, and I saw a gradual worsening and bloating of the abdomen area. It wasn't filled with gas or flabby. It was more like a basketball, and it just kept expanding in size over time. Finally, it was getting really awkward and uncomfortable. So along with the back pain and the shoulder pain and the bloating, in July I started noticing some shooting pains a couple times a day from the top of my pelvis down to the top of my legs. And it was mainly when I was sitting at my desk chair. And then by August of that year, I was so fatigued I could really hardly make it through a day without stopping to take a nap. It was a really good thing I worked from home because I had a bed in my office and I could put on my stretchy sweatpants, but I kept ignoring it. Finally, even though the symptoms were not exactly like my prior bouts with colitis, I figured I better get in, and it was probably the cause of my problems, so I went in and got checked. Almost 9 years ago, I scheduled an appointment with my gastroenterologist. I consider myself one of the really fortunate ones that had a doctor who recognized the symptoms I was experiencing and what they meant. He didn't feel the symptoms I had described to him were fit with the colitis diagnosis, so he immediately sent off for a CA-125 blood test and a transvaginal ultrasound. It was determined during the ultrasound that there was a lot of fluid in my abdomen, and they drained 1 liter of fluid for testing. So at the end of that appointment, I was told that I probably had ovarian cancer, and it was confirmed the next day with the CA-125 and testing of the fluid. So my primary care doctor called me that night and suggested I get an immediate appointment with a gynecologic oncologist. I met with him a week later and was scheduled for my first surgery another week later. Nothing was removed at that surgery. They basically opened and closed because the cancer was so extensive. But I did come away knowing that I was staged at 3C. I began chemo shortly after going home from the hospital, and then afterwards went back in for a successful hysterectomy and debulking surgery. I've since had 3 recurrences and have been treated 3 more times. It included 2 surgeries and over 75 chemo infusions. And before the first round of treatments was determined, my oncologist started thinking about what was on the market for new treatments and decided that I should have some genetic testing done. There were new promising treatments for individuals with a genetic gene mutation called BRCA. And even though I had no family history of breast or ovarian cancer, it was determined that I should probably just have it anyway. Amazingly enough, 3 weeks before Angelina went public with her announcement, I was diagnosed with the BRCA1 gene mutation. So I'm currently taking an oral study drug known for its success with the BRCA positive patients, and I've maintained my longest cancer-free period so far, which is going on 1 year and 10 months now. So I have to say that the absolute best day of my life was when I got the results for my testing, and then later on when both my girls and my mom tested negative for the BRCA mutation. So I consider myself one of the fortunate ones, because even though I chose to ignore my symptoms or put off going to the doctor initially, I had a doctor that figured out what was wrong and started the proper testing for ovarian cancer right away. So I hope that my story motivates others to recognize and not ignore the persistent signs and symptoms such as bloating, abdominal or pelvic pain, feeling full quickly, frequent urination, and tiredness as signs of possible ovarian cancer. And recognizing these symptoms and having healthcare providers that recognize these symptoms early are critical to improving the success in treating this cancer. Thank you.